listen, I've got a patient that agreed to let me talk to her while I'm talking to you about a situation that we actually see pretty commonly, and we think it's underdiagnosed, and that is painful intercourse. And generally, the specialists don't know exactly why patients have it. There's a workup that's involved, of course. It can be pretty complex, and sometimes they find answers, which is great, but we see patients so frequently who, after months to sometimes years of care, still were unable to find the solution to why they were having painful intercourse. And the medical term for that is dyspareunia. Now, sometimes patients will come in, like Catherine has come in to see us this year, with a diagnosis of something called vulvodynia or vestibulitis. These are just other ways of describing various, theoretically, inflammations involved that are related to pain. And you really need to see a specialist sometimes to recognize whether it may be anatomical, whether there's something that could fix it that's surgical, whether there's infection that's involved. But oftentimes after the complete workup is completed, they don't really have an answer. Sometimes they tell you you're crazy. Sometimes they tell you you're crazy without telling you you're crazy, but they really think you're crazy. But most people we found are not crazy. So Catherine came in to see us after seeing her specialist in town, after really coming to the end of that. And if I remember, Catherine, you ended up going out of town, a couple hundred miles away, to see a pelvic specialist, right? And they kind of continued to work up a little bit further. And if I remember right, they put you on a suppository on something. And when you came to us, you said, well, I think the suppository might be helping a little bit, but this is still affecting the relationship with my husband, right?
Yes, definitely. Just so much pain. I couldn't even wear jeans. I had to, not even wear underwear a lot of days. I was in so much pain.
Yes.
So, yeah.
Did you also have a pelvic therapist?
I did, and I'm still going to pelvic therapy because it seems to really help.
Right, and I think that's one of the areas of PT that a lot of people don't recognize that exists. PTs are so awesome, and some of them have specialized in pelvic therapy. Sounds crazy to most people, but having issues with your pelvis is a major thing. People have discomfort. It's a big deal, and it's like a lot of things in medicine. The answer a lot of times is multiple modality. And we don't ever think that the one intervention that we bring to the table is going to be the only thing that makes somebody better. But we're always pleased when maybe we made the big difference. Maybe we were the straw that broke the camel's back. So in this case, I guess we saw Catherine about 6 months ago. She gave us this history of almost a year worth of having these issues, having had specialist care. And what we've seen, even with patients that we don't make a diagnosis, sometimes we've seen patients with just PRP injection from your own growth factors out of your own blood draw, cause women that have urinary incontinence. Middle-aged women typically who can't do any physical activity without leaking urine on themselves. They have to wear a pad. They have to kind of plan their activities. They have to avoid activities. And so it's really nice to see. And we've studied this. We've looked at it, but not at the level sometimes drugs are that are highly funded. This is using your own tissue, so the research dollars for this are quite as available. But doctor to doctor, we've had these conversations. We've seen a lot of patients have help with urinary incontinence. And then we also just, they would tell us for years, and also I'm no longer getting dry down there. They tell us that I'm no longer having discomfort with my intercourse. Sometimes from a pleasure standpoint, everything feels better, it is better. And so you may have heard the O shot. This is one group that's kind of capitalized on this, we believe, deficiency in medical care. We've been able to bring something that helps patients with their relationships. Can you make maybe a comment about, like, I don't know if this ever affected your relationship with your husband, or if you just kind of felt like it might in the future, but tell me how this has affected you.
Like the O shot or just everything?
Yeah, just everything, yeah.
Yeah. So my relationship with my husband was definitely affected. We could not have intercourse. We've just been able to start doing that again, and noticed a huge improvement. Things are a lot better.
That's nice.
Better than they were before.
Yeah, and that's great. You mean even before you started having the discomfort?
Yes,
so, I mean, that just makes a tear to come by. That's a win. And by the way, this is like off the hip because we still got our tunes bumping on the speaker. You probably can hear that on the speaker, but hopefully I'm talking loud enough that all you people out there whose life is being affected by something like this can have relief. In this particular case, the specifics are, I noticed something that maybe just wasn't noticeable when she was seen by the specialist, either here and out of town, but I felt like her tissue looked like it had a condition called lichen sclerosis. This is a very, very underdiagnosed condition by the dermatologist and the other specialists. And the reason is they don't feel like there's an answer for it. So if there's not an answer for something that's really a home run, you don't really go looking for it. So a lot of times I think these get missed. I think they're out there like crazy. There's a lot of people that can get relief from a lot of different interventions, but one of them that we found effective and Catherine's found effective is using your own growth factor, PRP, inject it in the right place in the tissues, and in this case, getting a home run where somebody's getting their life back together. So anyway, just hope that's helpful for you. Talk to your doctor about it, and we, of course, would be happy to talk to any doctor across the country about what protocols we use and try to advance medicine, advance health, and people's relationships.